Hey guys, it's Troy with 180 Therapies in Monroe, North Carolina. Recently working with one of our clients who had an anterior hip replacement, total replacement last year. He's having neuropathy in his thigh and in the hip. Neuropathy in general is a tingling, numbing sensation, which got us to thinking about that situation now that he's a year out. So we started looking at some studies. This is one of the studies. It's a study of an anterior hip replacement study. They had 140 total procedures that were done. 107 of those procedures reported neuropathy post-surgery. At a 5-year follow-up survey, 60 of those 107 people replied to the survey, and 22% of those people had total resolution of the neuropathy, which means that there was 78% that still suffered from the neuropathy. So this is a very prevalent thing. With the popularization of the anterior approach to the hip replacement recently, it's a little less invasive, less post-surgical rehab. So it's very popular right now, but this is an issue. It's a very prevalent issue. So if you have had an anterior hip replacement and you're suffering from the neuropathy, either in the hip or the leg, you should give us a call, see if we can guide you through some things or book a session with us. All right, thanks.